Good morning. My name is Dr. Stephen Pliskow. I'm an OBGYN physician here in West Palm Beach, Florida. I am an associate clinical professor of obstetrics and gynecology at Kansas City University, and happy to be here today. I decided to do obstetrics and gynecology in my medical school training when I was a third-year medical student. Obstetrics and gynecology is the field that practices taking care of women for their obstetric, their pregnancy, and their gynecologic needs, their regular female needs from the time that they are child until the time that they are an elderly woman through the pre and postmenopausal time. I was born and raised in Brooklyn, New York, went to Canarsie High School, and knew at a very young age that I wanted to be a physician. I think maybe around the time I was 7 or 8 years old, going to my pediatrician quite often because I had asthma as a child, and seeing what the medical profession does and what my pediatrician did, I looked up to him very much. So I knew that I wanted to be a doctor from a very young age. To that end, I dedicated myself in my high school years to getting ready to be a doctor. At that time, there was only 10 medical programs in the country that allowed you to apply to medical school from high school. In high school, as a senior, I applied to all 10 of these programs and did get accepted. So I attended the 6-year medical program at Rensselaer Polytechnic Institute in Troy, New York. That's where I achieved or obtained my Bachelor of Science in Biology. And then Albany Medical College of Union University in Albany, New York. So that was a 6-year medical program. Normally the process takes 8 years. It's 4 years of college and then 4 years of medical school. This particular program allowed you to know that you were going to be attending medical school from high school as long as you maintained the GPA, grade point average, that they left as the cutoff for you to achieve while you were in the program. So the program was very intense. You went all summers long and actually had to take extra credits during your college and med school years to be able to make up all the courses. So all the coursework was done for the 8 years in 6 years. I'm very happy that I chose that route because it gave me the guarantee that I was going to go to med school as long as I did my work, and that was really my main goal, which I hope would be the goal for some of you as well. From there, after you finish medical school, you make the decision what type of medicine you want to go into. And in my 3rd year of medical school, when we do clinical rotations, I really loved my OBGYN rotation. Obstetrics and gynecology is very uniquely situated in that it has some medicine and it has some surgery. It has pediatrics, it has geriatrics, it has office procedures, surgical procedures in the office. It has genetics, some oncology, treating patients with cancer. So there really is every type of medicine within the field itself, and you can do whatever you want to do with the training and with the career in obstetrics and gynecology. You can further subspecialize. So that really appealed to me, and I did my 4 years of obstetrics and gynecology training at the University of Miami Jackson Memorial Medical Center, and then came to private practice here in West Palm Beach and been here for the last 32 years in the same practice. So a typical day in the life of an OBGYN physician involves making rounds at the hospital in the morning, so seeing your patients that are admitted to the hospital, whether they be obstetric patients or gynecologic patients. You would do your cesarean sections or inductions of labor, your deliveries. Those can come at any time during the day because patients go into labor and they deliver, so that is kind of not scheduled all of the time and can be unexpected and interrupt your day. But normally your day would be rounding at the hospital, then coming to your office, seeing your office hours, morning or afternoon, and then depending on when you have your surgical schedule blocked at the hospital, you would do your surgeries during that time. On call, you would be available depending on your group dynamics, whether or not you were on call every night for your patients or whether you were sharing that with a group of other physicians, but you would be on call at night for problems, emergency problems for your patients, and also for anybody going into labor and delivering at night. OBGYN is a very rewarding specialty, mostly because the patients that you're dealing with, you become part of their family, become part of their life. So when they sit around the dinner table and they talk to their family members, quite often you come up. So you've really become an integral part of their life, delivering their baby, sometimes multiple babies, and sometimes you're the generational doctor. So there are patients now that I've delivered them, and now I'm delivering their children. So that's quite rewarding as well. There's many other things that you help patients through being an OBGYN doctor. There's patients that have very trying times in their life, sometimes domestic violence, sometimes a divorce or a loss, a miscarriage. A baby can sometimes die. There are sometimes you're giving a bad diagnosis that there's something wrong with their baby, or somebody may even have cancer that you have to help them through and hopefully cure. So you definitely become an integral part of people's lives, and I mean, a lot of my patients have my cell phone number. They will contact me after hours if they have a specific problem. I love the fact that there are some patients that have to move because their jobs take them elsewhere, and they still call back here when they question their new doctor's diagnosis because they really trust you. So that's a wonderful aspect of our field. So when I'm not an OBGYN physician, I guess I'm always an OBGYN physician, but when I'm not practicing medicine, I like to spend time with my family, and I have been a Little League coach throughout my time as a dad with my son. I coached his baseball team and his lacrosse team throughout elementary school and high school. I'm also an avid sports fan, so I have seasons tickets to football and we go to the games all the time. I do a lot of extracurricular activities with helping the Carson Scholars Fund, with teaching kids the importance of reading as a youth. I also work at the University of Florida in the Library Leadership Board, helping with the libraries there, and also the arts program. I'm on the board of the College of the Arts at the University of Florida. So, you know, being a doctor is great, and it's very, very important. What you're doing is unlike any other profession in the world. You're helping people on a day-to-day basis, whether you're in public health, helping a whole group of people, or you're just taking care of one person at a time and making a difference in their life. But it's also important for you to have a life as well, and you can do that very easily as long as you know how to structure your time very well. And it makes you a better doctor being a well-rounded person. So make sure that you spend the time doing the things you love to do, and it will be rewarding for you all the way around. So as far as the ability to afford medical school and becoming a physician, don't let the economics of it dissuade you at all. There are ways to get funding to be a physician and to go to medical school, such as giving time after either to working in a rural area or an underserved area. The military is always an option. There are scholarships, there are grants that you can apply for. So don't let that dissuade you. You will make money as a physician. So even if there are loans that have to be paid back, they will be paid back. You don't have to worry about that. Don't let the economics either way drive you. You don't want to be a physician because you want to make a lot of money. That is not why you want to be a physician. If you want to be in the medical profession, and not only physicians, you would talk about nursing or any health-related profession, nurse anesthetists. You want to be in the medical profession because you feel it here, because it means something to you. The money is secondary. It will come because you love what you do. It is a good profession. Anything you do in life is going to have negatives. Don't let the negatives dissuade you. It may be that it's long hours. If you feel that the most important thing for you is to make money, don't do medicine. You want to do medicine because you love medicine. The money will take care of itself. There's many ways to get through school, and you will be rewarded for it financially either which way. For those of you that really feel this in your heart and you want to do medicine, just a shout out and a word to those that want to be doctors. If you know, I would really recommend you looking into the way I went about it. I was very happy with my choices and my decision, and there's more opportunity now than there was when I did this almost 40 years ago. So at the time that I was in high school, there were only 10 medical programs, Bachelor of Arts or Bachelor of Science medical degree programs in the country. Now there's about 50. So there's much more opportunity. Remember, they're very competitive. No matter what, if you're going to go to a good college, you're going to try to go to med school from high school, everything is competitive. You have to read, you have to study, you have to get good grades. You have to score well on your standardized testing, and you must have extracurricular activities. You have to show them that you are a well-rounded person. Remember, if you're going to try to go to a Bachelor of Science or Bachelor of Arts combined medical program, you're going to be going and doing medical school interviews when you're 16 years old. You have to go ahead and show them why you're exceptional, why you are mature enough for them to take a chance on you to be a medical doctor when you're 16 years old. Because the attrition rate, you can imagine, it's going to be high. There's going to be people that just can't handle the pressure. There's going to be people that weren't really sure but did it anyway. But you have to make sure, even though only 1 out of 10 people, somewhere between 1% and 10% of people that apply to these programs actually get in, you have to make sure that that is what you want to do. And I would try. I would definitely try. If you don't make it, don't give up. There are programs that exist now. There's one at the University of Florida. There's one at the University of Miami, where after you're there for your first year in college, you can apply to the Bachelor of Science or Bachelor of Arts combined medical program, and you will get into medical school as a freshman or at the end of your freshman year or at the end of your sophomore year. There's about 30 of those programs. So there's another way for you to accelerate the process, and maybe it's not a 6-year med program like I went through. Maybe it's a 7-year program or an 8-year program. At least you know that you've gotten in. So that's another opportunity for you after high school is in your freshman or sophomore year to apply to these combined programs. So when you pick your college and you know you want to do medicine, don't just pick the college that's closest to you or this college I like because it's a good college. Pick one of them that has one of these combined programs, because when you're there, you can meet the people and do volunteer work and try to get yourself into one of those programs. But even if you go the whole 4 years of high school and then 4 years of college and don't do any accelerated program or any combined program where you get pre-admitted, you can apply at the end of your 4 years of college and then go the normal route to med school. And just in summary, I would say the best thing I ever did in my life was becoming a doctor. I'm very happy that I did it. I wouldn't change it for the world. I'm very happy the way I did it. But there's multiple ways to get things done, many ways to skin the cat, so to speak. And no matter how you do it, just make the most of it for yourself so that you enjoy what you do every day, because that's the most important thing. Wake up, and when you go to work, make sure you're enjoying what you do every day.